April 1st. I'm here in studio with Dr. David Tapscott with Pana Community Hospital. Great to have you here, Dr. Tapscott.
Hey, thanks for having me. Appreciate it.
So tell me a little bit about yourself. When did you, or where'd you go to school? All that stuff.
I'm super local. I'm from Edinburgh, so I've made it, between 10 and 20 miles from home for most things. I left. I got an engineering degree. You have to have a degree of some kind to get into medical school. I went from there, medical school to University of Missouri, residency here in Springfield in orthopedic surgery, and then some subspecialty training in upper extremity surgery in a little Ivy League place in Rhode Island called Brown.
Yep, I'm familiar with Brown, as that's the place where Andy went to college in The Office, right?
yeah, there you go.
Anyway, well, that sounds like you've been through quite the journey. You mentioned engineering. How do you feel like that played into the medical world and your profession now?
I think in a lot of spaces it doesn't, but orthopedics is a mechanical event, right? So all we're doing is putting people back in their mechanical best, and so it's been great for me. There's a lot of crossover in principles, and there's also a lot of crossover in the implant design. So when we're evaluating what implant or what device might be best for somebody to get them back to where they need to be, being able to understand and interact with those engineers can really help you, I think, make a more informed choice.
Well, what are some of your orthopedic specialties? I know you mentioned upper extremity.
Yeah, that's correct. So I do general orthopedics. Every orthopedic surgeon, or most every orthopedic surgeon, can take care of the basics of a knee, a hip, an ankle. The basic pain, the basic I need an injection. But upper extremity is where I provide full service. So from clavicle to fingertip, anything from a rotator cuff or a broken shoulder, a broken clavicle, all the way down to carpal tunnel, a distal radius fracture, which is a pretty common wrist fracture we see a lot of, to your broken finger or your laceration. We see the upper extremity world is very common. There's a lot that happens to your hands. You use your hands a lot in your life, obviously. And so we see a pretty wide array of things.
Yeah. And I would imagine too that, well, actually, let me back up for a second. We're getting ahead of ourselves a little bit. Briefly, what is orthopedic medicine?
So orthopedic medicine, that's a great question. So people think when they see surgeon on the door, it means they're coming in for somebody to do a surgery on them, which is scary. And actually the bulk and majority of what I do is non-surgical treatment. There are many things in this world with the right therapy, the right injection, the right timing of bracing or casting. We can get you back to your A game and never lay a knife to your skin. And so I think, I think the orthopedic side of it, being an orthopedic surgeon, means I'm an orthopedic provider. I take care of arms and legs and your back. And I hopefully can do that without surgery, but we have that tool if we need it.
Okay. And you're here on behalf of Pana Community Hospital. I know you see patients all around the area, but I'd imagine you do see patients at Pana Community Hospital, right?
Pana Community Hospital is fantastic. When I'm trying to explain this to people in Springfield or folks I work with through the Springfield Clinic, I tell them it's like going to a restaurant, and I ask them if they want to go to a big chain restaurant or if they want to go to a really well-run restaurant, and there's only one of them. And the quality and ownership that people have at a place like that is a little bit different. The same thing's kind of true at Pana Community. Patients who come in to us come in through Pana Community. They tend to have a very highly owned experience, and kind of from the front door and the time we get them to meet them till the time they kind of are better and on their way. Everybody has a lot of ownership in Pana Community because everybody who works there wants to see that hospital go.
When do you see patients at Pana Community Hospital?
So we're there every Friday. Pana Community, and this is a community-owned hospital. It's not a conglomerate-owned or a for-profit hospital. It's a community-owned, truly old-fashioned community-owned hospital with a board of people from the community who run it. They decided to invest some money and build a beautiful OR. They have one of the nicest, cleanest, best equipped ORs that I work in, frankly. It's fantastic. And every Friday morning, we're doing surgery there if necessary. And we see patients every Friday starting about 10 or 11 all the way out until the end of the business day. My nurse practitioner is down there scattered through some other days as well. So if we have somebody who needs to be seen sooner, they don't have to wait till Friday. One of the great things about Pana Community and the way that they've been partnering with us at the Springfield Clinic is they really understand what they're good at and maybe what needs a larger facility. And there have been several occasions now where we've been able to take somebody who's a little sicker, take care of them at one of the hospitals in Springfield when it's necessary, and then do all their follow-up close to home, get all their physical therapy. Pana has some of the best physical and occupational therapists around. And they have things like aqua therapy, and they have good imaging. Right now, they're putting in a brand new MRI machine, state of the art. There won't be anything nicer in Central Illinois. The only competing magnets will be its peers. And so they're investing in the right services. And the nice thing about them partnering with us is that we can really give some good, consistent care, and there's not a lot of patient handoff, nobody getting lost in the mix. They're great.
I know Pana Community Hospital's physical therapy is so successful too. You mentioned a little bit in terms of the other partnerships that they have, but I know that there are some really key partnerships Pana Community Hospital has in the physical therapy world in Pana too.
Yeah,
that helps them.
It's fantastic. Drew Kasner, who is an athletic trainer and also does quite a bit of athletic training in the setting of therapy. Incredible. He runs something called the Excel program. He starts these kids at a young age. He teaches them body protective things. He makes them a little faster, a little stronger, a little better athlete. But the other thing he's doing is teaching them body protection. My young athletes in the area work with him, and I mean it's universally excellent. And again, they're the right size. So Drew has ownership of those kids, those athletes from a very young age. He's on the sidelines with them. And so they've partnered with the school in that way. They've also got some really good upper extremity therapists. There's a lady named Karen Beck, who's my occupational therapist. And I know that if somebody's seen Karen, I have to add 5 minutes to their visit, because the first 5 minutes is them telling me how much they love Karen, because she just gets them taken care of and she cares about.
Right. Well, I think you've given a lot of reason for why Pana Community Hospital is so attractive to you as a physician or someone who practices orthopedic medicine. What about Pana itself is attractive to you?
So I think we're living through something that we're going to reflect on. Christian County is going through a special time. And as we see state jobs transition to partial work days, as we see some of these people working from home, as we have the 4-lane highway now from Taylorville on, we're seeing these communities stretch out a little farther.
Right.
I think Payne's got the potential to grow. They've got some great resources in town. They're starting to do some nice things in the downtown. They're trying to restore that. Payne went through a rough time, but I think they're kind of turning and on the mend. I expect to see them grow. I expect to see Christian County grow. And I think Payne community is positioning themselves to be a real force in the market as far as providing care in their region. And we're starting to see people from a good ways out who are coming specifically to Pana, because Pana is bringing specialists in. They have a Springfield Clinic urologist, the Springfield Clinic orthopedic surgeon. They're working towards having a plastic surgery who can help with plastic surgeon to help with things like wounds and things of that nature. I mean, there are good things happening there.
Let me go back a little bit to the new surgical suite and OR. That's something I understand they've been working on quite a bit. You seem pretty impressed with it.
Oh, I've operated at several facilities connected to Ivy League institutions. If I took the Harvard fellow and myself, the Brown fellow of 2 years ago, and we walked into the Pana operating room, it would be the nicest operating room we would work in. They don't have anything nicer at Brown, and they're fantastic. They whoever did the shopping did a really good job of shopping, because they didn't buy something that would work. They bought whatever the nicest right tool was, and then they bought 2 of them. You can tell the place is community run, because when they got equipment, they got equipment that they would want used on them. It's fantastic. It's so clean, and it's the right size. Because there's a staff that's the right size to have ownership, they care about every phase of care for the patient, and there is no someone else's problem. If it's not perfect, they take ownership and make it perfect. They got a special group up there. Stephanie, who runs it, has done an amazing job.
Anything else that you'd like to say about Pana Community Hospital and, where and when people can see you?
We're there, and we'll get you to the right person. All they got to do is call Pana Community, any line. Just pull it up on your phone. You give us a call. We'll get you in. We'll get you seen. The biggest thing I want to say is that I think they're providing a service also to kids. So one of the big deserts that we have in the central part of the state is access to pediatric orthopedic care. And part of the reason is because taking care of kids is a little demanding, a little time consuming, and it's constraining. It takes a lot of resources. And I talked to Trina there, who's the CEO, and I said, I want to be able to take care of kids' fractures. And she gave me the blessing. And I said, hey, this can be a little expensive and a little bit resource consuming. And she said, if there are kids with broken bones and we're not taking care of them, we're not doing our job. So they're a real patient-first organization, and they've allowed me to take care of quite a few pediatric fractures. So don't be scared to let us take care of your cast or splint on your kiddo, and know that they're there to support every step of the way. It's been fantastic.
I want to talk more about injuries with especially in the middle of football, soccer, girls volleyball season, etc. It's the fall sports season, but first let's take a quick break. That's Dr. David Tapscott with Pana Community Hospital. Your stream brought to you by Landmark of Taylorville, where you always do better with Landmark, and People's Bank and Trust, where they put people first.
WTIM. Your information station, WTIM.
Welcome to the WTIM Morning Show. I'm Avery Cooper. Your stream brought to you by People's Bank and Trust, where they put people first, and Landmark of Taylorville, where you always do better with Landmark. You can find those streams online on the TaylorvilleDailyNews.com Facebook or on YouTube at WTIM TV. So I have Pana Community Hospital's Dr. David Tapscott here in studio, and he specializes in orthopedic medicine. And right now, in the world of orthopedic medicine, I'm sure you're paying attention to the fall sports season, namely football, obviously soccer, girls volleyball season. What are some of the common injuries in the sports world that you see, Dr. Tapscott?
Well, I think it really depends a lot on what we're talking about. Obviously, there's the dreaded ACL, which shouldn't be the dreaded ACL. It should be something that we understand that happens, that we've got better solutions for, and that kids are getting better all the time. But outside of that common knee injury that we see, and that's a pivoting and a knee injury that's really downstream of the amount of cutting and running that we do, we see a lot of things that are treatable in a boot or a cast. We see the occasional crack or fracture. We see the broken clavicle or the separated AC joint. The biggest thing to do, I think, is for folks to remember that an early evaluation is always reasonable. And I think we have a culture of toughness in sports, which is great for kids. But I also think there needs to be a culture of evaluation. And the problem is a lot of the kids I meet, the first question they have isn't, do you think I'll walk normal again? It's, what week can I get back out there? which is amazing and admirable. But also, one of the things we have to do is set realistic goals with the kids. And so sometimes I'll have a parent come in and they say, I'm not sure the kid needs looked at. They're limping a little bit. He tells me he's fine, or, he's got a little pain here, and it's a real injury. And so what I tell parents is, if they have a suspicion, come in, let's get an x-ray and have an exam.
Yeah. And that way too, you can get to the source of it quicker and hopefully get them back out there quicker.
Yeah, it's a whole different world. I think with good, we're so lucky. We are healthcare rich in this part of the state, from availability. But with the connected trainers that we have in our surrounding towns, Pana, for example, we got Drew Kasner. Those trainers can get those kids out there and really give them evaluations. It used to be you'd see the doctor every 2 weeks and he'd check on you and tell you if you're doing better or not. Now our kids get injured, especially if we get them in Pana community or we get them in these local community settings. And Drew Kasner might text me 3 times a week to let me know if this kid's looking good, and we think next Thursday maybe they'll get out there the first time. And so if you have an injury, the earlier you can develop a relationship inside the care stream, the more we can do to get you back early or get you the care you need early.
Well, obviously that's for when an injury occurs, but how can athletes prevent injuries so that never happens?
I think there's a lot that can be done. I think if you look in Pana, the Excel program is a great example of knee protection and prevention. Girls jump training. Women have a little bit different alignment of their hips and their knees. They're built just a couple of degrees different. And we think part of the way that they land and jump, it can be difficult for their knees. I encourage families. There's great research. There's great national research that multi-sport athletes, kids who don't dedicate themselves to one sport all year long, but play a few sports, actually end up better at each sport, better at their main sport, and less likely to be injured. So I encourage people who are, let's say their kid plays winter baseball down south, fall wood bat league, and regular spring league. I try to encourage them to break that up and add a different sport to give the kid rest. So what we can see are overuse injuries from kids who aren't playing multiple sports. So I encourage at least 2 sports of engagement if the kid's able and interested.
Well, obviously, if an athlete becomes injured and needs surgical correction, that's where you can step in, I'd imagine. Do you perform surgeries?
Yeah, there's surgery to be done, and the biggest thing to remember is, we do it. We try to do it at as high or higher of a level that can be done anywhere else in the country. One of the worst things, and anybody from Christian County can know this, is when they think that we get second place because we're a rural community. I want our care to be as good or better than you could get in St. Louis, and that's what we pride ourselves on. But the big thing to remember is those surgical decisions, and we'll do you a great job if you need a procedure. There are things that just need fixed.
Right.
But we'll keep partnering with you every step of the way so that you understand your steps of care, you understand what's happening to you and for you. And before, during, and after, we have resources for you to connect with us anytime that you have a question or want to talk something over.
What happens during recovery?
That's a great question. So it used to be that we would hold things still forever. And then we kind of learned through time and through big metadata research studies that especially the shoulder. So shoulder dislocations are something that can be devastating to a kid because they can. Have you heard of a kid saying my shoulder keeps coming out?
Right.
So in the 15 to 25-year-old age range for boys, a first shoulder dislocation in a contact athlete is almost a guaranteed second dislocation without intervention. And now what we can do is we can go in there and tighten that shoulder back up through an arthroscopic or poke hole based surgery. And greatly decrease the risk of a second dislocation. And that used to come with 8, 10, 12 weeks of immobilization. And now we've got that duration much shorter. Early therapy, early access to therapy means we can get those kids back in the game quicker, and we can get them in with the confidence that their shoulder's not going to come out again. If you ever want to see an athlete not fully return from an injury, have them not be confident in the joint after the injury.
Tell everyone again the days and times you're available to see patients at Pana Community Hospital.
We're there on Fridays. You guys can call Pana Community. We're there every Friday. And my nurse practitioner is there on some random smattering of days. And she's fantastic. About half my patients like her better than me. They say, Dr. Tapscott, thank you for the surgery. I feel great. Where's Amy? Which is just, I don't know if that's a compliment or not, but it happens. But the other thing to remember is I think one of the things that we get fearful about is the small ER, the small emergency room. And we meet a lot of people who have an emergency room. And for most things, the Pana Community Emergency Room does a fantastic job. They also have a fast care, and those people are directly connected to my cell phone. And so if you have if you get a cut or you have an injury and you go into that small prompt care, you're not getting any different of a surgeon or a service than you would get in Springfield. And you're getting somebody who can get a hold of me in about 2 minutes. So we encourage you to come check that out as well.
Dr. Tapscott, thank you very much.